Chapter 17. Internal bleeding. Internal bleeding may occur in any part of the body. It is important to know the exact place in order to treat the hemorrhage properly. Bleeding from the stomach. Bleeding from the stomach is very common, particularly in those who have ulcers. The blood may be evacuated in two ways. Some may be vomited, and will probably appear dark brown in color, owing to partial digestion of the blood in the stomach. Most of the blood, however, will pass through the bowel and appear as a black, tarry stool. This change in color is due to further digestion taking place within the small bowel. Bleeding ulcers are always serious, especially if there are black tarry stools. This should always be investigated by a competent doctor. The bleeding might be due to something else, such as cancer of the stomach, or perhaps cirrhosis of the liver. Cirrhosis is more likely to occur in people who drink large quantities of alcohol. Unless the bleeding is quickly brought under control, the patient may collapse and die. In any case, call the doctor at once. Meanwhile, keep the patient lying down, and apply an ice bag over the abdomen. Do not give him anything by mouth, especially if he is vomiting. Bleeding from the rectum. Blood coming from the rectum or lower bowel is usually bright red in color. This type of bleeding most often arises from hemorrhoids or piles. Cancer of the bowel is another cause of bleeding from the rectum. Be sure to consult your doctor at once before the blood loss becomes too severe. Meanwhile, apply an ice bag to the bleeding area, if possible. Treatment for bleeding 143. Bleeding from the bladder. Blood appearing in the urine at any time except during menstruation always means something serious is going on in the bladder or kidneys. Bleeding may arise from stones in the bladder, or from some acute inflammation, or perhaps from small polyps or tumors. Even tuberculosis may be responsible for blood in the urine. Bleeding may also occur if a person is taking anticoagulants, or blood-thinning drugs, to keep his blood from clotting. The bladder may be the first place where this type of bleeding will show. Call your doctor at once, or take the patient to the hospital for a full examination. Bleeding from the vagina. Regular bleeding from the vagina, occurring every 28 days, is perfectly normal. But bleeding between menstrual periods is decidedly abnormal and may indicate some condition that should be corrected. Heavy bleeding between menstrual periods, or during pregnancy, is always serious. Bleeding occurring after the menopause may indicate the presence of cancer. All women in middle life should have a complete pelvic examination at least every 6 months, whether they are bleeding or not. Remember, cancer does not cause pain during the early stages. Bleeding may be the first sign of trouble. Therefore, see your doctor whenever abnormal bleeding occurs. Treatment for internal bleeding. Put the patient to bed, and keep him lying flat. If he tends to vomit, turn his head to one side. If the bleeding is coming from the pelvis or abdomen, fill a rubber bag with crushed ice and gently lay it over the area where you think the blood is coming from. If the patient seems thirsty, give him a few small pieces of crushed ice. If the bleeding is coming from the vagina or rectum, elevate the foot of the bed about 18 inches. You can do this by raising the foot of the bed and placing it on an ordinary straight chair. If the patient is pregnant, call the doctor at once. Meantime, keep her quiet. Do not let her move around any more than absolutely. 144. Internal bleeding. Necessary. Lay an ice bag over the lower abdomen and give her all the reassurance possible. Keep her lying down until the doctor comes, or until you can get her to the hospital. Nosebleed. Nosebleeding is common at every age. In children the bleeding often is caused by injury to the nose. In elderly people the bleeding may arise from high blood pressure. If the head has been injured, and there is a mixture of blood and watery or spinal fluid, there may be fracture at the base of the skull. It is important to have an X-ray in all such cases. Treatment for nosebleed. Keep the patient sitting upright in a comfortable position, with the head held back. Apply steady pressure to the side of the nose that is bleeding. Press on the nostril and hold it firmly for at least 12 or 15 minutes. The patient should breathe through his mouth during this time. He must not blow his nose. Have someone apply cold cloths to the back of the neck or to the face, or both. If the bleeding is heavy and does not stop in a short time, call the doctor. It may be necessary to cauterize the bleeding area. Sometimes a large injection of female hormone, given intravenously, will help to stop the bleeding. In cases of heavy bleeding, it may be necessary to have the nasal passages packed with special gauze to prevent further hemorrhage.